This is Kerri Wachter reporting for Global Medical News from the American Academy of Dermatology's annual Summer Academy in Boston. Joining me is Dr. Mary Lupo, a practicing cosmetic dermatologist in New Orleans, who gave a talk offering advice and tips on achieving optimal results with cosmetic fillers. Could you talk a little bit about the idea that it's not so much the product that makes a difference with fillers, it's the experience of the person who's doing the technique?
Yeah, my talk here at the AAD Summer Academy meeting was called "It's not the filler, it's the filler." And what I mean by that is it's not the product, it's the person administering the product. And the judgment and the experience and the body of knowledge that we have as dermatologists that affords us the understanding of skin and anatomy to be able to get the best results from any product that you use. There are a lot of good products out there. And in fact, in my own practice, I actually use every FDA-approved product. But I pride myself on understanding the specific nuances of each product to better understand which one to use in which person. Some examples would include the age of the patient. For example, an older patient will typically require a more robust fill and need more volumetric change to their appearance. They'll also need to have some other procedures done to complement the benefit of the fillers. They may need laser and light-based therapies, chemical peels, or other adjunctive treatments. Another consideration should be the actual defect to be corrected. We use different products in etched lines than we do in folds. And when you have redundant folds, you need to use a more robust and more structural product. I think the technique needs to be changed depending on the area to be injected. And one always needs to remember that if there's a fold, it's important to look at the area superior to the fold. And if you augment and enhance that area, then often the fold itself will not need as much fill material. So these are some of the examples of the variables that a good dermatologist takes into account when they are doing the informed consent with the patient. It's important to identify perhaps which patients might be at risk for complications. If a person is a heavy smoker, they would definitely be at greater risk for necrosis. I think if a patient has history of allergies, one must take that into account in the history-taking process. And of course, the number one complication from fillers would be bruising, and it's important to make note if the patient is on aspirin or anticoagulants, and not so much that that's a contraindication, but certainly the patient needs to be aware that they are at increased risk of bruising, and that the bruising might be more severe and have longer duration. Other things that need to be taken into account is the timetable for the patient, whether or not any social downtime is acceptable, because some fillers cause more swelling and bruising. Others take longer to take an effect, but some people actually like the more gradual benefit that they will see with some fillers. So all of these things need to be understood by the doctor, and I think dermatologists are uniquely qualified to understand the differences between fillers and the differences in patients' skin type and in their overall needs in order to look better, and to look better in a very natural way.
This is Kerri Wachter reporting for Global Medical News.